So, Dr. Levy, you are coming up to almost 20 years as a medical director of the Osher Clinical Center. So first, congratulations on that. And I was hoping you could just share a little bit of your trajectory into integrative medicine as a practitioner and the arc of your time at the Osher Clinical Center at the health.
Okay, well, how far back should I go? I was going to be a doctor since I was a child, and in college, I was caught up in the late 60s and did this ridiculous thing, I guess. I dropped pre-med halfway through. So I graduated college and was not eligible to go to medical school and did some other things during the time that I was between college and finally actually getting into medical school. I was at the time in 1975, I was managing a health food store in Cambridge, and there was a World Vegetarian Congress to be held in Maine. People from all over the world were coming, and it was more than vegetarianism. It was about health, nutrition, and what especially the doctors in the Far East and in Europe called hygiene or hygienic medicine. And I just was blown away because I read so many little books by the people that were coming. So I went to this World Vegetarian Congress where there was like 1 or 2 thousand people and way up in Maine. And I listened to lectures and met all kinds of people. And the lectures by these doctors were so fascinating. They were not wedded to all the things that we do here in the United States. They were open to supplements and healing and wholeness. I remember one doctor saying, if we could invent everything that there was in a piece of whole wheat, and we made it perfectly, we made a package and we packaged it up and we made it the same color, and you wouldn't be able to distinguish the two. One was a whole wheat, one was synthetic. How would you figure out which was which? And everybody just looked, and he said, I know, put them both in the ground and water them and see which one sprouts. And I thought, yeah, there's some force, there's something missing beyond just chemicals that this guy believed in. It was just the force of nature, call it God, whatever place you want to put it, something special. So the types of people I met were amazing. And at that conference, on the way home, I pulled over and said, I'm going to try again to get into medical school. And if I jump ahead in 1970, in late 76, I actually worked as an orderly in a hospital. First, I went and made up the courses I'd missed in 75 into the next year. Then I worked as an orderly, taking care of patients day and night in a hospital. And in 1977, I was sitting in my freshman year of medical school. So it began way back. And I had, I guess, a different bent than most students. I'd certainly changed a lot since the 6 years that had gone by since being a pre-med. And I loved learning medical. I didn't like the way people were being taught in medical school. It was very primitive, I thought. 180 of us in a classroom, 7 hours, lectures, the whole bit. But I loved it once we got with patients. And I only applied in primary care internal medicine. I thought I'd like to take care of the whole person. I was very much interested. I thought I was recruited by the Department of Psychiatry to be a psychiatrist. I said, no, I'd rather use whatever skills I have in that, taking care of people when they're physically ill. So I became a primary care doctor. And I think that was easy to bring in nutrition and lifestyle and health and just looking at a whole person. And I ended up teaching and working in a course on the patient-doctor relationship, which I cherish as something that was beginning to fade away as machinery and techniques grew, ultrasound. You don't need to talk to the patient anymore. Just take a bunch of pictures and x-rays and images and blood tests, and you can say what's wrong. And practically not even say hello, just send them to the OR or give them this drug. So I discovered that the therapeutic relationship, though, is at the base of everything. You still have to talk to someone, and even after they had the treatment, they needed to understand what happened to me. What I thought it was this, and you're saying it's that. So I taught the patient-doctor relationship course at Harvard as I was a primary care doc, and I did that for 25 years. And more, people knew I'd look at they'd tell me, acupuncture helped me more than the pills. Well, tell me about that. Or I went to a craniosacral therapist. You ever heard of that? I'd say no. And I just learned about all these other modalities that we certainly weren't taught. And these were not crazy people. These were people quite willing to participate in standard Western medicine. And they found they were more open to other options than any of my colleagues. In fact, you had to whisper about some of this in the beginning. And then I moved to a center where I could be a primary care doc. Um, it was a holistic medical center that had some things I found far out, and eventually became medical director there. But there was a great place to be a primary care doc and do what we now call integrative medicine. And then the opportunity came up in whatever that was, 2003, to join this training program where David Eisenberg, who founded the clinic and used money from a grant to train people from all these disciplines. And I loved what he said. He said, I want you all to become bilingual. I want you to be able to speak in the language of your discipline. You know, if you're an acupuncturist and you want to say the liver is, you know, the chi is blocked in the liver, fine, but you have to be able to listen to a liver specialist who says, I don't know what the chi is, but the liver function tests are normal, and let's reconcile that. So he wanted us all to become bilingual, and I think we did over time in those 14 weeks. And then the 4 years, the long years that elapsed, that we knew each other, and we had a clinic that was virtual, sort of like Epic, being in the pandemic, but we would meet twice a month. We'd share patients. We would have patient presentations, lectures, and we stayed together for those 4 years. And in 2007, we finally opened up the clinic at the Brigham. So there it is, all those years later. So the physical clinic at the Brigham is now just started its 16th year. It opened in the summer of 07. So that's the journey. And during that time, once I entered that clinic, I retired from primary care. You can't do everything. And I learned how to do what I call a whole person integrative medicine consultation. And that's what so I'm a consultant now. Primary care docs have a lot on their plate, and to do both, I found impossible. I also wanted to bring this kind of medicine into a major, very conservative teaching hospital. And so I had to really focus all my time in what I would say and how I would communicate with the other doctors. That was my role for sure, one of my roles. Not sure if that answered which question, but that's my journey.
That's good. Yeah, I wanted the arc of your journey. That's great. Now, okay. So at the beginning of the Osher Clinical Center, you had a cohort of practitioners come together, and there's been a very special culture that's been developed there, right? And you've shepherded that culture over the years. Can you speak to that a little bit and how that's influenced how practice is actually conducted at the Osher Clinical Center?
I think that was the biggest thing. If I even look back at one thing I accomplished or helped accomplish, was to keep this team of people in so many different disciplines with so many different worldviews. Because when we were training, we had some subspecialists there to help us just navigate the training, and they'd say, "What? I don't get that. Your opinion of what's wrong with that person is totally not medical." And for us to be able to still talk to each other and understand each other, and then as personalities, people are different, even if you're all in the same discipline. To keep people talking to each other and finding out what's needed next was a big challenge, and it was wonderful. And it's a credit to the people that were recruited that they were open to each other. And that's what we did. We learned to speak to each other, to disagree, or to work together and say, all right, I don't know how this is going to work, but these headaches aren't getting better. Let's try acupuncture, and let's talk after 6 visits, as an example. And some of the people from that entire beginning from 03 are still in the clinic. 4 of them that are still practicing in our clinic. We've stayed together as colleagues and friends. It's kind of unbelievable in some ways.
Yeah, it's pretty unique.
I think so, yeah.
Now this question might actually speak to what you just said, but can you speak about what you're most proud of as having been at the helm for almost 20 years?
I think it's sharing, besides, keeping the team together. If I had a role, I did have a role in that, but such a credit to the people. My door was open a lot. and various things happened. And from that, from a discussion with one person, I said, let's bring that up at the team meeting this coming week. And you have to just stay on top of that. I think developing an integrative medicine consultation that merged East and West is my biggest accomplishment, to figure out what that is. And it has to do with suffering. Certain concepts were now circulating around the country in integrative medicine as it grew. And I was very interested in the difference between curing and healing, the difference between being a mechanic and a gardener, which is one of my constant talks, the difference between pain and suffering. And I remember people telling me, I lectured on a couple of these in the very beginning. We all gave little lectures to each other. Everyone still remembers. I'm Dr. Suffering. Talk about suffering and what that means, how to manage or nurture hope. These were things that I think were some of the things that I stood for. And it resonated. These resonated with every discipline. So then people understand that even as an acupuncturist, curing is fixing the broken part, but healing is becoming whole again, being restored back to health and wholeness, back with my family or people I love. And they all were interested in that. They said, that's what we do. We do that all the time. That comes natural. In medicine, there's a tendency to just keep reducing down to something mechanical and offer that. And in medicine today, that you're paid the most. The more mechanical you are, if you do a procedure, it supports the hospital. Talking for an hour to someone, reaching out to them, doesn't pay. It's part of good medicine always, and everyone will say that, but doesn't pay the same as doing something with scalpels or needles or devices.
I know, that's a shame.
Yeah.
So what you were just saying, I'm just kind of thinking, what would you say is your legacy? What would you consider your legacy?
I don't know my legacy. I guess it's those things, those principles, that preserving or fighting for the power of the therapeutic relationship, and not letting things be reduced, not letting our visits get cut shorter and shorter to be more efficient, fighting like crazy with people above, in the managerial levels, saying, no, you're taking away, you can't rush people this way and make the assembly line work. One legacy, I guess, then, is that just fighting to keep it the way it should be, which is let each discipline use the amount of time they need. It would have been more efficient if, say, we hired some doctors that did a little acupuncture. And I'd say, no, I want a terrific acupuncturist, the teacher that taught that doctor to do the acupuncture. And they say they need 40 minutes. So again, it was preserving the pace of medicine in a clinic that is very hard to make a lot of money without the mechanical procedures, and to let the hospital realize we're worth it. We're worth it. We're contributing something to the general gift, the general what giving of good health and healthcare. And you can't just measure each clinic as a cost center, but we're part of the whole. And I think we can make a really big difference. And if we get better and better at what we do and do more preventive medicine, it'll be worth a lot monetarily eventually. So that's where we got it. People then said, okay, the wellness part of this movement is very useful, but still, we're all struggling with that.
It's a work in progress.
Yeah.
So would you say having the Osher Clinical Center embedded within Brigham Women's Hospital and Harvard Medical School has kind of influenced the culture around health and wellness?
I would say that's my, I never think of a legacy, but that's one thing that I was able, I decided how I was going to do consults. My consults have footnotes. If I say acupuncture could help back pain, I'll cite 2 studies that say acupuncture and back pain, because use the science, use the evidence-based medicine that we all practically worship, even though it's always limited. Embed that in every consultation. And I think that left a mark, because my goal in the beginning was I'd love half of our referrals to be from physicians in this clinic, in the hospital. And that's what we did get. And now I don't know. Now I wonder if we broke it down carefully, about a third of the internet, people just hunt around and go, oh, here's a good place. And a third is probably their physician. My primary care said, I don't know much about alternative approaches to managing your blood pressure or your cholesterol or your pain or whatever it is. Go to the Osher Clinic. They have some good people there. So the legacy is establishing a place that had credibility among clinicians who were not necessarily bent in that direction. Because there are many clinics out there that have a following, but it's very self-selected, and doctors might poo-poo the place and say, yeah, go there if you want, but come back here when you need real care, to be the most.
So you are effectively bridging different ways of approaching medicine. So you
Yes.
help facilitate that, right?
And I think everybody can identify with the therapeutic relationship to some extent, that's definitely important. No matter whatever I do, nourishing the relationship, the connection with the person is very important. We all have a story to tell about why. I had a herniated disc. I was one of the first presentations of a patient at our integrative medicine grand rounds. And I was a classic herniated disc, and the pain went down my leg into my big toe. Now, I'm a doctor. I know a little bit about that, about a dermatome. I know about the L5-S1 nerve root, but my big toe would get totally numb. If I didn't know, and I even woke up at night thinking, uh-oh, if I move, maybe I'll become paralyzed. And then I realized, no, you know better than that. But patients don't. So people need to be with them all the time saying, what did you think that meant when you got a numb toe? Let me tell you, that's totally normal, and it doesn't lead to paralysis. If you find you can't move the toe, I want you to call me. There's making meaning out of something that they had made a very dire explanation to themselves, which of course increased their suffering and all kinds of other problems. So that dwelling on the making meaning and helping people with that meaning and understanding it is still going to be central to medicine, to me, indefinitely. As long as there are human beings treating other human beings, there's going to be a therapeutic relationship. It'll never get replaced by robots or drive-through some things. There's going to be a person there.
Yeah, that's great. Following on from that, imagine you're speaking to an audience of integrative medicine practitioners, which you will be. What words of wisdom would you have to share?
Wow, people, yeah. I should have looked. I once wrote a talk, The Dark Side of Integrative Medicine. And it included things like, first of all, a complete rejection of standard medicine, which I think is silly. There's plenty of useful, very useful things, but standard doctors are not giving toxic, deadly poisons called medicines to people. Becoming aware of the good sides of the regular medicine that we are now thinking wasn't enough. And that's just what I would say. It's incomplete, but that doesn't mean it's bad. Regular, standard medicine. And in fact, I can prove it. Most of you in the group have gone to a doctor, maybe many times. And maybe you did it just to rule out something terrible, but we have the techniques to do that. And then you feel free to do a cleanse or whatever it is, some herbal treatment. So they work together very well. The second thing is if whatever you're doing is not enhancing the therapeutic relationship or the role of it, something's wrong. And so I have criticized many who practice very strict functional medicine where you just give a ton of samples, your blood, your urine, your hair, your sweat, your saliva, your poop, everything gets sent out. Back comes 52 beautiful pages of things, none of which comes from the patient's discussion. It's all this data we've gathered. So that seems to me a step backwards. Instead of finding out how is this person suffering? That should be my goal today. How is this person suffering? And okay, it could be these 2 or 3 things, and I'm going to explain to them why I want to order these tests, but I'm going to stay with the person, stay with the person, stay with the person. I don't think that always happens in integrative medicine, almost as a rebellious thing. I also think because there's disappointments with standard medicine, we're susceptible to pseudoscience or not such well done science. and junk science even. And I think we should be really careful about that, that some famous integrative doctor says you need all this amount of vitamin D. I don't care what the other people say. Um, that's not a step forward. So keeping our mind open and not because standard medicine has failed you in some way or it's been incomplete for you, don't throw it out and pick what is useful from it. Some of the methods are great. So stay with those. Those are the kinds of things I say to people, because I'm disappointed that some people have gone off on this. It can be lucrative to just do this other kind of medicine where we're going to do a lot of tests that you never had done by your primary care doctor, and they won't even do it because we're special here. We do stuff that they won't do. They don't explore the fact that maybe some of those tests were useless or not quite as helpful as you would have thought, or taking samples of your saliva to show that your adrenal axis is stressed. You could have asked them about their lives and you would have found out they're quite stressed. I didn't need all the blood work and saliva to find out. So that worries me, this takeover by actually the loss of the therapeutic relationship and then sort of pseudoscience-y stuff that again is mechanical and lucrative, but maybe stepping a little bit in the wrong direction. And then I'd also say that I would, if I did my career again, I would absolutely be a primary care doctor with integrative medicine as my, I wish there was a training in primary care integrative medicine. That was because the tools and the approach are just the right balance for me. And I'd love that to be there always. I think it's just good medicine. Maybe wouldn't even have a name. It would just be primary medicine again. Mm. So I forgot what that question was, but oh yeah, if I was talking to people in this field, which a lot of people do ask, they want to know should they go down this road. So I get asked that.
Yeah. Yeah. It's your words of wisdom to share with the community, which I think you.
Well, I sometimes quote two other things. One is my 7th grade biology teacher on day 1 said, 50% of what I'm going to teach you this year is wrong. I just don't know which 50%. It will be shown to be wrong. And I thought, wow, this guy's open to, and then he went back in the history of medicine, the things we thought and what turned out to be partially true and not true at all. And the other one, the other really big one for those more spiritually minded is, I think it's believed to be from one of the disciples of Buddha, the first Zen patriarch. So many people who call themselves seekers, they're seekers of the truth, seekers of something deep and spiritual. And he said to them this famous statement, which it's written and it's gone through the ages, try not to seek after the truth. Rather, cease to cherish opinions. And that's pretty hard because we all have our cherished opinions. And in fact, nowadays we only look at news that goes along with our cherished opinions. If we could just stop cherishing them, say, these are my opinions, 50% are probably wrong in some way. So cease to cherish opinions is a good one. I feel it all the time. I'll read something and go, oh no, they're going to say something that I think is good is not good. All right, take a breath and read the article and see what's going on. Yeah. I can just let go of because this is really going to hit a cherished opinion of mine, but tough.
Yeah. So, no, that's true. We're very attached to our own opinions, irrespective of the fact, right?
Yes.
So you're going to be retiring soon, and you've led the Osher Clinical Center for 20 years. What opportunities do you think there are for the Osher Clinical Center going forward?
A lot. I think the clinic going forward, because one of the things I'm doing first is slowly transitioning out of the role of medical director. We now have a clinical director, which took away a lot of my responsibilities, and soon we'll have a new medical director when that's completed. And the clinic has changed. You don't have to make a new team like we did back 20 years ago. It's already established that it's okay to have an integrative medicine clinic in a hospital because they're now many Osher centers, for example. So it's worked. It's possible. It's not so pioneering to open a clinic. So I think the next thing is going to be to pull out what's great about things like the therapeutic relationship and all the other mind-body uh, therapies and treatments and modalities, and bring them into all treatment, not just, for the few people interested, would you like, or you're very stressed, so you should take mindfulness-based stress reduction. Everyone should begin to get better at mind-body techniques to help change behavior, to help reduce stress, to help understand our lives and what we're going through. So someone that's got a good, strong, solid background in mind-body medicine will be important, and how that permeates every part of medicine, like the same way the therapeutic relationship does. I would say also, we've got to get serious about endowing and get very practical. We need money to, constantly we hear another endowed chair in surgery and this and that. We need endowed positions so that some of these clinics can feel like, all right, we're here to stay. We don't have to constantly try to make sure our budget fits in a field that's hard to make a lot of money. You can't charge $500 a visit to break even. And some of the things we do are just not covered by insurance very easy. So, and the person has to be good at making relationships with other departments and other people and the development office. And then I think just knowing how to do what was the main thing for me, to build a team, to add to the team, to decide what modalities are worth bringing in, who's the right person to do that. Many people might be good in acupuncture, but not the best person for a hospital-based team. Someone's got to be ready to work within the constraints of a hospital, if we're going to stay in the hospital system. So that person's going to have to build a team now, now that we've seen how teams work and what's needed, and have that thing that used to be my first job as part of their job, keep the team together. Get someone in and help them be part of a team that takes care of people. So those are some of the things I say to the next medical director. I assume for a while I'll stay around in a smaller position and just do my integrative medicine consultations and have no managerial or leadership roles. Just be the old guy.
Be freed from those responsibilities, right? You can
Yes,
dive
exactly.
into medicine, which you love.
Right.
And what are you excited about now that you're going to be retiring?
I think I don't know when I'll be fully retired, but as I get more time, I want to actually tell people, I joke that my goal in life now is to become nobody. I stole that quote from what was his name? Baba Ram Das. It was Richard Alpert, who was a PhD at Harvard, who then did psychedelics with Timothy Leary, and then became Baba Ram Das, a sort of guru-ish person. And as he got older and older, he had a stroke, and then he was getting older still before he died, obviously. And someone asked him, "What's your goal?" And he said, "It's to become nobody." So that's pretty esoteric for some people, but it's way harder than you think. Give up my labels, all the things that I've been, and just become nobody is actually becoming very big in a lot of ways and open to life. So I hope to spend some time alone, more time in nature, like I have done in the past. And of course, my granddaughter is teaching me a lot. I didn't know what a gift a grandchild is. Very different than your own child. You can really be there in a way, because you don't have to worry about tomorrow's lunch or how to get them to school. You just can be with this little person in a way. I've heard this before, the bumper sticker, if I knew grandchildren were so much fun, I would have had them first. But there's something about that that's really real. I'm learning about life from this little person who's now 2.5 or 2 3/4. Just how they just getting into their head and their world seems to be helpful in my own growth. So those are some of the things.
That's wonderful. That's lovely. Anything else you want to say, Don?
Oh, there's one thing. I think a lot of people in our clinic talked about hope. And we're often, yes, they nicknamed me Dr. Hope sometimes because people came away saying there's hope, mostly because they were told there's nothing I can do for you by other doctors. So they were hopeless. which by the way is one of the criteria for depression, hopelessness, just complete, it's hopeless. And how do we nurture hope? And is there a difference between false hope and true hope? And a lot of the folks in our team would say, doctors worry too much about false hope. It's not, don't worry about it. Try to see what you can do to nurture hope in people. And I think that's really big. And I'll tell one last story. There was a person who was released from prison about 10 years ago after 22 years in jail for a murder he did not commit. And the DNA evidence was shown, and somebody confessed in another prison. And it matched. And he was definitely not guilty and set free. And so, of course, this was a big scene, and there were reporters interviewing him. And I remember this one question, one reporter said, "Did you ever lose hope?" And he just looked at them and said, "What, are you kidding? I lost hope all the time. Every day I lost hope. That's not the right question. The question is, how do you regain hope when it looks hopeless?" And I had to do that over and over and over. And I thought, that's so part of medicine, that no matter what is going on, even if the situation is looking more dire, I quoted this paper on hope in which a man who has dealt with pediatric horrible things, and when they were told, for example, okay, we're going to have your scans and we'll see what they show. Okay, scans show, what are you hoping for? And they'll say, a miracle. I want this to disappear. I want to wake up like it's a bad dream. Okay, anything else you're hoping for? After a while, he would ask that. And they would say some other things. So then the scans would come through and they were bad. The tumor's grown. And you talk about that for a minute. And there's some grieving. And then he said to them, given what we now know, is there anything you hope for? And immediately people said, yes. I don't want to be in the hospital. I don't want to be in pain. I want to be with the people I love. I have all these hopes and needs. And we never stop hoping, no matter what it is. Even if we're at the bottom of a 100-foot well, we're hoping maybe somebody will drop some water or it'll rain. I don't know. There's always room for real hope because that's our condition. So I think another part of medicine is stop saying, I can't do anything for you. There's no hope. Nurturing hope should be part of our science. How's that?